Hello, my name is Dr. Kalitenko, and today we are going to talk about bioidentical hormone replacement therapy. Now we are going to discuss the hormones we give most often. And most of the time, we give three hormones. We give testosterone, estrogen, and progesterone. Of course, we can give other bioidentical hormones like hormone thyroid is thyroid hormone. We give quite very rarely we give cortisol, which is the hormone of adrenals, and we give HCG, which is very powerful hormone, and some other hormones, but it's quite rare. Most of the time, we give those three: testosterone, estrogen, and progesterone. And testosterone is most of the time we give it for men because with age men start producing less and less testosterone. That's why they start losing their uh, body mass, muscle tone, mass index is going down, and they don't sleep as well. They develop erectile dysfunctions. They cannot maintain erection as good as before, as long as before, and it usually is related to testosterone decline. And what we do, we usually give testosterone as a cream. They rub it in, and they maintain the level of testosterone which is optimal. Is with the support of testosterone they start sleeping better, they're more confident, the erections last longer and are much more potent, the libido is going up, and that's very good for both of them, for a man and for his spouse or his beloved woman, and everybody is happy. But don't think that testosterone is only for men. Testosterone is for women as well, because testosterone is a builder. Women need bone mass and muscle mass too. They need libido. That's what testosterone is responsible for, libido. As soon as testosterone goes down, libido goes down too. And guess what? It is very important for muscle tone. So what happens is with the loss of testosterone in women, the muscles start sagging, and especially in face. So when somebody has a sagging skin in cheek area, it's most of the time testosterone deficiency, as well as wrinkles. You know, as they say, chicken hands. Chicken hands is because of the testosterone loss. That's the classic sign of testosterone loss. So women need testosterone too, and we are gladly giving them testosterone to improve their libido and the confidence and improve muscle mass, etc., etc. The second one is progesterone. Actually, progesterone, they start losing, the first one they start losing is progesterone. Progesterone and testosterone, when a woman enters menopause, they usually go down first. And that's very important because with loss of progesterone, the women start having problems, gain weight, sleeping issues, mood issues. I had a woman who came with progesterone deficiency, and he said, "Doc, please help me with my daughter, because before I was very calm, I was very good relation with my daughter, but lately I am always yelling at her. She doesn't want to talk to me anymore." And the reason for that was very simple. It's nothing to do with the woman itself, with herself, but there was a deficiency of progesterone. So we gave her progesterone, and she started talking to her daughter, and her daughter started talking to her. The relationship was restored. That's very important. So sleep, mood, they're heavily dependent on progesterone. But the third, and probably the most important hormone, is estrogen. Estrogen, usually there are three forms of estrogen: E1, which is estrone, E2, which is estradiol, and E3, which is estriol. We usually don't work with estrone because of its side effects, but we usually use estradiol, E2, and E3, estriol. When we see that they find that a woman has estrogen deficiency, so we usually give her both E2 and E3. E3 estriol is the least potent, but is the safest. That's why we want to be on the safe side. We want to be on the lower side, so we want to give as much estriol to combat the symptoms, but we give also estradiol as well to maintain high potency, but we give it less because we want to be, it's on the safe side. They give estriol much more than estradiol. And that's how we usually do. The combination is called biased. We usually use biased 20-80, 20% of E2 and 80% of E3. and it's very good. It works pretty much well, and usually don't have any problems with that. The blood concentration of estradiol goes quite quickly as soon as we give the cream, and with the support of bioidentical hormones, testosterone, estradiol, estriol, and progesterone, usually women start feeling better. As their sleep improves, mood improves, the vaginal dryness resolves, sex drive goes up, and that's why women love it. But another big advantage of that is because as soon as we give it as a cream, actually a woman can put different doses of hormones on the day-to-day basis. So supposedly today she's going to rest, so today she needs less hormones, but tomorrow she's going to have sex multiple times, so she needs more hormones, so she can put more hormones on her skin, and that's why her level goes up. And that's very big advantage, because actually this way of administering bioidentical hormones puts you in charge of her health, not the drug, not the drug company, not the doctor, you. And that's the most important thing, because it gives you confidence and gives you happiness. Thanks to bioidentical hormone replacement therapy. Thank you. Bye-bye.